Hey, Brady. So tonight we're talking about integrating BFR with high intensity interval training. My name is Ed LaCara. I'm the Director of Education with Smart Tools Plus. I'm also in private practice, what I do most of the time. Um, I wrote the book, Dr. LaCara's Approach to Blood Flow Restriction Training, and I practice in my clinic in Dallas, Texas. Like I mentioned, if you're on social media, please give me a follow on Instagram or on YouTube, but also connect with me on LinkedIn or X or wherever else. All right, so what you're going to learn today, we're going to talk about HIIT and how we implement BFR with high intensity interval training, how to use BFR to increase training stimulus without increasing joint stress, two key strategies BFR during uh, high intensity interval training or BFR during the recovery phase, um, and then how to build a practical HIIT and BFR workout so you can use it immediately, and then progress and individualize the method safely and effectively. So, what is HIIT or high HIIT? Now, I do want to take a second. Often it gets confusing between HIIT and HIT. When we're saying HIIT training, high intensity training, usually means that we're lifting weights between 65 and 90% of our 1 rep max. High intensity interval training means that I'm doing intervals, getting my heart rate high, and then bringing it back down low. You can do that with weights, calisthenics. I use a machine called Vasper that uses blood flow restriction training and cooling. And I do that twice a week in order to get my cardiovascular fitness. So make sure that you can differentiate between HIIT, HIT, 65 to 90% of your 1 rep max versus high intensity interval training. Tonight we're talking about high intensity interval training, HIIT. Um, these are usually short, intense workouts, usually 20 minutes or less, but stressful. And really, these types of intervals are much more beneficial to the system. Number one, it reduces the amount of overall stress on tissue and joints. But number two, you get a better effect, both cardiovascularly and resistance training wise. The other thing this can be confused with is sprint interval training, and just kind of a differentiation between how you're programming these things. So why HIIT works. It produces a high cardiovascular and metabolic stress, which produces a strong adaptation stimulus. It improves VO2 max, endurance, and metabolic efficiency, triggers both central and peripheral adaptations, and comparable or superior benefits to steady state in a lot less time. So, like 20 minutes to increase your VO2 versus 45 minutes to an hour minimum to increase VO2 at these lower intensities. So, higher intensity just does a better job. And the goal is to create maximum internal stress efficiently without long duration training. Now, it's not to say that we never do long duration training. I do recommend to my patients that they do one long duration, 60 minutes or longer, in a zone 2. If you're not familiar with the zone training zones, it's where your heart rate basically is at a level that you can still have a conversation, but it's difficult. So you're able to breathe, you're able to have a conversation, but it's hard. And so doing those for long periods, like about 150 minutes per week is the goal, and then 1 or 2 sessions of high intensity interval training per week, plus some resistance training, 2 to 3 times per week for the resistance training. So the hard part about doing these high intensity intervals is a lot of times these are associated with increased impact, like running, jumping, sprinting, and some people just can't do that. So how can we do that without overstressing tissue, especially if tissue's been injured? So we can use BFR in order to reduce the load and still get the same effect. A lot of times, high intensity interval training will produce large muscle soreness or DOMS, delayed onset muscular soreness, increased muscle breakdown, temporary swelling, and circumferential changes. So, and this, you might have a longer demand on recovery. So, it is higher intensity. So, if you have compromised joints or tissue, you may not be able to tolerate it. So that's why BFR can be a game changer. If you're not familiar with BFR, blood flow restriction training involves applying a cuff to partially restrict venous blood flow. Um, that's actually a mistake. Not partially restrict, fully restrict venous blood flow while maintaining arterial inflow during the exercise. So you're reducing the amount of blood flow into the limb, and you're fully reducing the blood flow out of the limb, the venous. And what this does is it creates a hypoxic environment. It creates high metabolic stress, and you also get a systemic hormone change, increased growth hormone, increase insulin growth factor, potentially increase in testosterone, at least temporarily. And it really helps the local tissue get better at utilizing less oxygen, which makes you more efficient. So what's happening at the local area is really important. There's three main ways to use BFR. So continuous means that I'm using the cuffs inflated while I'm doing the exercise. So the cuffs stay inflated during exercise, and then during your rest periods, they are then deflated before your next exercise bout. So I'm doing a bicep curl. I do 4 sets of bicep curls with the cuffs on, and then I deflate before I switch to a tricep extension, let's say. Resting BFR means that I'm doing exercises with the cuffs on or off, I guess. But then when you're during the rest period, you're putting the cuffs on. And what you're trying to do is trap metabolites that you've created during the exercise. And then intermittent BFR means that the cuffs are inflated during the exercise, and then they're deflated during the rest period. So continuous, intermittent, and resting. If you have the smart cuffs, you have these settings already kind of built in. So why combine HIIT and BFR? You want to provide a systemic cardiovascular stress. BFR provides both local and systemic muscular and metabolic stress. And together they can create a strong conditioning stimulus with reduced joint and impact stress, greater training accessibility, and more flexible programming options. So when we talk about internal loads versus external demand equals like how much speed are you working at, the impact or the workload. Internal demands are the physiological stress like heart rate, fatigue, and metabolic demand. HIIT traditionally increases your external demand, and BFR typically increases the internal load or internal demand. But when combined, we can achieve high intensity without high impact, which is the goal. So there's quite a few studies looking at this, like how you use high intensity interval training with BFR enhances sprint and maximal aerobic power in male endurance athletes. We have seen BFR utilized with Tabata, which is a form of high intensity interval training. And the BFR with Tabata compared to Tabata alone had better impact. Again, you can look at these studies to see how exactly they did it. And you can look up Tabata on what that protocol looks like. But not just did they get better at whatever Tabata intervals that they did, but they also had outcome changes, meaning increased vertical jump test, improved wind gated anaerobic test, and improved badminton specific endurance testing. Here's another study looking at 2 weeks of high intensity interval training in BFR versus HIIT alone in obese patients. You had greater fat loss with BFR and improved metabolic response, growth hormone, and epinephrine in the BFR group. So two primary ways to integrate BFR with high intensity interval training. You can either restrict during the work or you can restrict during the recovery. So you choose. Application 1 would mean you have the BFR cuffs on with the low intensity, high intensity interval training, and then, or you would do passive BFR after the high intensity interval training. So I'll give you some examples. So application 1, you're going to do low load hit with BFR, meaning the cuffs are on and I'm exercising. So personally, I use a Vasper, which is a recumbent bike. I have cuffs on the upper extremity and the lower extremity. They're at very low pressures. I know what you're going to say, but Ed, you always say never have the cuffs on the upper extremity and the lower extremity. I know. when you're more advanced and you have more advanced programming and training, you can start integrating both uppers and lowers. They just have to be at low pressures. And then you basically do these low load interval exercises to stimulate the high intensity demands with the cuffs on. You're going to be at about 60 to 80% LOP on the lower extremity, 40 to 50% LOP in the upper extremity. Typically in the lower extremity, I'm always going to be more at that 60%. 80% is too hard to actually get normal movement with. It's just too high of a pressure. So 60% is usually enough. So this works well because it causes the muscles to fatigue faster, oxygen delivery is reduced, metabolic stress rises quickly, and you get a strong training stimulus. This leads to a higher perceived exertion, increased muscle recruitment, effective conditioning at lower loads, reduced joint stress while still challenging the system. So what a protocol might look like, you keep the cuffs on and inflated, and then you do some endurance exercise work. You're gonna do things that get your heart rate elevated and then bring it back down. And then compared to without the cuffs, you don't have to get your heart rate as high. So you're just working towards getting at that point where you can't speak without even measuring your heart rate. If you want to get fancy, come in my clinic. We do a VO2 max test. We see where those changes are metabolically, and I can prescribe you a specific heart rate associated with those zones. But when you're just trying to get some movement in, get some activity, get more fit, just look for, being at the point where you're like a zone 4, where it's pretty challenging. You're not at a maximal go, but you're at a point where it's pretty difficult. So you're gonna perform a sprint at the max effort with the cuffs deflated, and then apply. So this is the protocol 2. This is using the BFR during the rest period, meaning that if you're doing like a sprint on the bike, you could have the cuffs actually on, but not inflated. I typically do this protocol without the cuffs on. And so you're doing, let's say you're on the football field, you're going to do a 100-yard sprint, which should take, 10, 12, 15 seconds. Once you're done with that sprint at your maximal effort, you then put the cuffs on, you inflate the cuffs, and then you're going to keep those cuffs on for 2 minutes. And then you're going to deflate the cuffs, take them off 2 minutes. You're going to have them deflated, and then you're going to do another sprint. So what this is going to do is going to trap metabolites, and then you're going to reperfuse, and you're going to keep recycling. I typically will do this either with sprint intervals, or I'll do it with athletes on a bike. And with the bike, they don't have the cuffs on during the exercise bout. So they're doing the exercise without the cuffs. I just want to make sure that that's clear. And then they put the cuffs on after they're done during the rest period. Inflate for 2 minutes, deflate for 2 minutes, repeat. Start off with 5 intervals, increase by 1 each week up until 10. So that's pretty good. It's been shown to increase VO2. It's been shown to have a great effect aerobically. Here's that protocol: 5 sprint intervals, 1 sprint per week, increase weekly. Everything's kind of defined here for you. So again, 2 primary ways to integrate BFR with HIIT. You're going to do it with low load BFR HIIT, meaning cuffs are on during the exercise. You're doing a lower intensity, but you're stimulating you a little bit more. And then passive BFR with high intensity means the cuffs are on during rest at a higher intensity. It's more performance based. You think about when you have the cuffs on, it's really hard to sprint or bike. And so that's why we're not using the cuffs we don't want to alter biomechanics. You're just putting the cuffs on to trap the metabolites during rest, which, believe it or not, is as effective as, even with resistance training, as doing it with the cuffs on. It's just cumbersome. It's like trying to take during each rest period and putting the cuffs on. You just can't do it in the rehab setting or in the performance setting. So, but it's not bad doing it this way when you're alternating, putting the cuffs on during the rest period. So here's a full workout setup using BFR and HIIT. So you're basically having the cuffs on during application 1 during the exercise, 15-second work, 15-second rest, continuous BFR during intervals, total of about 5 to 10 minutes. So that might mean you're doing 15 seconds of step ups or 15 seconds of air squats, and then you rest for 10 seconds, 15 seconds, something like that. And you're doing like a 1-to-1 work to rest ratio. That's essentially what a Tabata is. And then, so if you did a little bit of a walk, like a brisk walk with no BFR, 10 body weight squats, 10 step ups, and then now you start doing 15 seconds on, 15 seconds off with the cuffs on. You can do this up for 20 minutes. We never keep the cuffs on longer than 20 minutes at a time without taking a reperfusion rest. And then application 2, passive BFR after hit. So what this might look like is you do a warm up and then you're going to do a sprint interval, 10 to 20 seconds, max effort, cuffs are off and deflated. And then you're going to put the cuffs on, inflate to 60 to 80%, and you're going to hold that on for 2 minutes. Then you're going to deflate the cuffs for 2 minutes, and then you're going to take the cuffs off and do another sprint. Okay. So you're going to do increase the duration between 5 and 15 minutes. So you're going to keep building up your tolerance. Add a second interval block, meaning take 5 minutes off and then do another 20 minutes if you want to, and slightly increase your intensity. That's how you progress. Passive BFR, you increase the number of sprints, improve your sprint quality, maintain consistent recovery. So these all should be individualized for the patient or the client, and for yourself. You're trying to increase your ability to do work. And so start light, continue to build up, and do a slow progression, and have a slow approach. Key takeaways: HIIT improves performance but can be limited by fatigue and impact. BFR increases internal load without increasing mechanical stress. 2 primary ways to combine HIIT and BFR: low load HIIT with BFR with the cuffs on during the work, HIIT with passive BFR, cuffs on during recovery only. Passive BFR allows you to maintain intensity while enhancing metabolic stress, and start with lower volumes and progress gradually. All right, so what's coming up next? Next month, I'm going to talk about BFR for neurological patients like stroke and MS and others. And so your registration gets you registered for those future sessions once a month. There's my contact information. If you have any questions or you need a consultation, please reach out. And here's the references that I utilize, so you can always go back. We do have a 5-day BFR bootcamp coming starting next Sunday. This is a paid course where I take you through 5 days of screening and quick start guide, upper extremity rehab or upper extremity exercises, lower extremity rehab or lower extremity rehab exercises, aerobic capacity training, and then fitness training. So you can inquire, ask me questions, pretty reasonable, and you'll get individualized attention here. We do have a BFR professional certification program. This is through BFR level 1, and then if you want to move on and do BFR level 2, that's for performance. So foundations is level 1, that's getting started, and rehab level 2 is clinical and performance. Then we also have an instrument assisted soft tissue mobilization class and certification. So you can always scan this QR code. So I kind of think of it as BFR level 1 and level 2, and instrument assisted soft tissue are for my rehab professionals, athletic trainers, physical therapists, chiropractors. And then we have the and fitness trainers, really, for level 1 for sure. And then you have the boot camp is really for your non-medical professionals or people that are not working with other clients. And hopefully connect with me. And we do have a Facebook group. So this Facebook group is for BFR. So if you want to jump in there, you can ask questions. I've got my coaches in there. I'm in there, and my VAs are in there as well. If you don't have cuffs yet, just kind of know the difference between the kind of the 3 Gen 3 cuffs, which are you have a separate pump and you're tethered until you deflate. And then, or when you inflate, you can take this off. So these are good for the pool. Gen 3 Pro also you can use in the pool. Multi-user clinical setup, higher precision control, designed for professional use if you're using these on individuals. And then we have the app-based for clinicians that are okay using their phone or an iPad or Android to control. You do get an educational discount for being here, so you just use Education 10 for anything on the Smart Tools Plus website. And that's all I got. So thank you so much for joining me. I hope to see you at our next video. If you are watching this on YouTube, please like and subscribe. Thanks so much. Bye for now.